It's really common for bariatric surgery patients to run a heart rate that's lower than the standard normal range. Why does this happen? Is this okay? In cases where it's not okay, what can we do about it? Let's talk. My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and we're involved not only in doing the bariatric surgery, but of course taking care of patients for months and years after the surgery is finished. And so we see all kinds of changes with physiology that are mostly good and sometimes get a little bit off track, and we learn how to manage these as well. So today I'm going to talk about heart rate. First of all, it's normal before surgery, in the context of the obesity disease, before it's been treated, to run a bit of a rapid heart rate and to have the heart under some strain caused by the increased demand of the excess weight. And I've talked about this in another recent video, talked about how the heart tries to compensate for that excess strain, how the heart can go into heart failure. So the underlying problems that can come up from the obesity disease are covered elsewhere, but suffice it to say for right now that most people who are seriously overweight, they run a fairly normal heart rate, maybe a little bit on the high side while they're sitting still because their heart rate is under a bit of increased load. But as soon as they get up and start moving, they have massive increases in their heart rate to levels that are typically well above normal for a certain amount of movement. And this again is because the heart is under a lot of increased load or increased strain as caused by moving around this excess weight. So at least in the early phases, the heart becomes stronger in the process of trying to compensate for this excess load, and it has several ways of doing that besides just the increased heart rate, but increased heart rate is one of those mechanisms. And then a cool thing happens as people lose 20, 50, 75 pounds after their bariatric operation. The demand on the heart decreases down to a normal level. And even if these patients were not really athletes before the surgery, as long as we got to them, as long as we intervened before they had damage, then we can expect that they actually have a strong heart, or we could call it a runner's heart, that they had thanks to the continuing increased load, increased weight before the surgery. And now as the weight is down, the heart is not having to work nearly as hard. It's as if we unloaded half of the load that that heart was carrying, and now instead of beating 90 per minute, it can take care of all the blood flow needs by pumping at 60 per minute, or 50 per minute, or sometimes even 40 per minute when the patient is resting and relaxed. Now back to the question, is this okay? And so the real answer is, as long as you feel okay as a patient with a low heart rate, it's actually great, because the fewer times that the heart has to beat per minute, then the fewer strokes that it has to work through, and the decreased overall lifetime load that the heart has. So de-stressing the heart and allowing the heart rate to come down is actually a positive factor for longevity, as long as you feel okay. Now, there is such a thing as the heart rate becoming too low. In a small percentage of cases, I would say 1 to 2% of massive weight loss patients have a heart rate that is too low so that they feel weak and they feel tired and they feel dizzy. And by the way, I'm not talking about dehydration right now. That's a different topic. I'm talking about all the time with normal hydration. And so what we do in those cases is, with the help of our cardiology colleagues, is that we might implant a little pacer device to keep the heart rate from going too low. Now, one other thing I'll say about this is that having the heart rate go too low to a level that the person actually feels bad usually represents some degree of heart damage that was present before the weight loss. Because a normal heart, when it's de-stressed, it will slow down, but it will continue to provide good blood flow and good pumping function throughout the body. So, bottom line, the decreased heart rate typically happens because of cardiac de-stressing as the weight comes down. Most often it's a good thing when the heart rate goes down, and in the few cases where it's not a good thing, where the patient does not feel good, then that probably represents some pre-existing damage that will need some management with the help of the cardiology team. Interesting stuff. Thanks for watching.